Scott, you can go ahead and get us started.
Fantastic. This is Scott Becker from Becker's Healthcare. I'm thrilled today to be joined by four of the best executives in the country, true leaders in healthcare. We've got with us today Lloyd Dean, Pam Sutton-Wallace, Micheline Davis, and Gene Woods. We're co-hosting today with Tony Waller. Tony Waller is the remarkable founder of the Leverage Network. The Leverage Network is an organization whose sole mission is to help African-American leaders become leaders in healthcare, board seats, leaders in health systems, and so forth. The topic today is, of course, always a current one, and even more current in the aftermath of the George Floyd murder, killing. We're discussing race in America and race in healthcare. Before I turn it over to Tony, who will lead moderation with me today, I'm thrilled to have Tony with us today, the Leverage Network, great organization. I'll ask each of our panelists to briefly introduce themselves. Then we'll walk through this afternoon 5 to 6 questions about race in America and race in healthcare. Lloyd, can I ask you to take a moment to introduce yourself?
Thank you, Scott. I'm Lloyd Dean, the CEO of Common Spirit Health. I just want to thank again Scott and Tony for hosting what I think is one of the most critical discussions that we in this country and we as African Americans and we certainly as members of the healthcare community are about to have. And it's an honor to be a part of this dialogue with the colleagues that you are about to meet. Thank you.
Thank you. And for those that aren't aware, Common Spirit Health is the largest not-for-profit health system in the country, side by side with Kaiser Permanente, with about a $35 billion organization. Lloyd, thank you for joining us. Pam, can you take a moment to introduce yourself?
Absolutely. Good afternoon, everyone. Thank you so much for having me. It is indeed a true pleasure and honor to be here, as Lloyd said, with our colleagues. We all know one another well, and it's just a joy to share in this honest conversation about race and healthcare. I'm Pam Sutton-Wallace. I work currently as the Senior Vice President at New York Presbyterian. I'm responsible for the Brooklyn and Queens markets, as well as the medical group practices at New York Presbyterian. I joined that team about 7 months ago. So what a time to be joining a team working so hard in New York City. But I consider it a real privilege. Thank you.
Thank you. And again, New York Presbyterian, a top 5 to 10 healthcare system in the entire world, as ranked by U.S. News and World Report, and Pam Sutton-Wallace, a world-class executive. Thank you, Pam. Gene?
Yeah, good afternoon. Pleasure to be here and to be here with friends. I haven't seen them in a while, so it's great to see them here together in this forum to talk about, as Lloyd said, a really, really important and timely subject. My name is Gene Woods. I'm CEO of Atrium Health. We're a 40-hospital system, multi-state system, headquarters in Charlotte, and I also did a stint as the former chair of the American Hospital Association. So to all my colleagues out there, I say welcome to the conversation.
And Gene, for people that aren't aware, started with a $5 billion system. Not to put it in numbers, but it's important to be able to fulfill your mission. You have to be sizable. Now, a couple years later, it's about a $14 billion organization, an amazing transformation of the Atrium system, what was the Carolinas health system, into what it is today. So, Gene, our hats are off to you. What an amazing job you have done. Micheline, can you take a moment to introduce yourself?
Thank you so much, Scott. I am Micheline Davis. I am with RWJ Barnabas Health, which is the largest academic medical center system in the state of New Jersey. Here, I drive our policy-led, equity-focused social determinants of health work through something called social impact and community investment. It is truly an honor to be a part of this discussion, this long time coming discussion with these particular greats within our industry. So thank you so much for having me.
Thank you, Micheline. I've had the chance to visit with you 3 times or so in the last couple of months, and always a magnificent pleasure. And you also with the magnificent academic medical center and elite system. Thank you so much. And all of our executives, the thing that sets these 4 executives apart is magnificent brilliance together with great compassion for everyone, including the African American community, of course, but magnificent mix of brilliance and compassion. Tony, I'm going to turn it over to you.
Thank you, Scott. Thank you so much. And first and foremost, I want to say thank you to my colleagues who have joined us today. I mean, we couldn't have a better panel of experts and executives in the healthcare industry than the ones we have here today. And Scott, I want to especially thank you for partnering with me and the Leverage Network in having this very bold and courageous conversation. It is a conversation that's been a long time coming, and unfortunately, it took what has happened in the past 90 days for us to get here to have this conversation. One of the things that we've talked about, and I've also shared, is that I contend that in order for us to get to the other side of this, to a space where we're beginning to heal, and we're really beginning to find an approach, a way to heal the rights of what we've been going through, we have to have very bold, candid, and transparent conversations. And I know a lot of these conversations have been happening all over the country over the past several weeks in the industry. But this one I want to make unique in that we have Black healthcare executives who are not the top executives in the industry, but they're Black. And we live this experience every day. And so we want to speak from that heart and that experience. So let's jump right in to the questions. And actually, the current landscape really sets the stage for such a conversation as it is today. I mean, if you think about it, in these past 90 days, and it's only been 90 days, we've experienced the gravity of over 400 years of oppression, repression, suppression, and aggression against Black lives. And as we all know, it began with the COVID-19 pandemic, where it unmasked the severe disparities and inequities that we've known and that has been experienced in communities of color, particularly Black communities. And in that experience, we died at 3 to 4 times the rate of our white counterparts. And then that experience was escalated with the public death of George Floyd, which brought to light the depth of the racism that still exists in this country. So together, these two pandemics have shown us that we really haven't made that much progress since the civil rights movement 50 years ago. So there is this tremendous gap that we're still experiencing between the basic human rights of minorities and that of the majority population. So with that, I'd like to start the conversation by hearing from each of you your perspective on where this current gap is that exists between the basic human rights for Black Americans in comparison to the majority. And Lloyd, maybe we'll start with you.
Thank you, Tony. And let me just preface my comments by saying that I come to this conversation with mixed emotions. I am happy that we are gathered and that all of the folks who are listening we have touched a consciousness in this country, in this world, that I am hopeful will allow us to once and for all have the courageous conversation, but more than just talk, to take definitive actions to address systemic racism in this country. And when I say mixed emotions, I am, disgusted that we sit here in 2020 replaying over and over again an element of history in what I think we all believe and say is one of the greatest, most advanced countries on the planet. And the fact that it took a death to touch the consciousness of not just the nation, but the world, has to call all of us to pause and question and ask the question, Why? But I also come to this conversation with hope that through this transparent dialogue, that each and every one of us will look within ourselves, will look within these gifts that we've been given, the positions, the opportunity, the voice that we have, to unite and say once and for all, never, ever again. Will we sit idly by? Will we be silent? Will we not rally around the importance of life? And yes, that Black lives matter, but drive toward all lives mattering. We know that throughout all of the work and the ministries of healthcare, that health inequities have been a part of our history. But what sits behind that fact is racism playing a significant role in going back decades, in many years, inequalities driving and moving forward where we sit here today. We can do better, we must do better, but we will never move from this position if we don't acknowledge the depth of systematic racism in this country, and if we don't come together to move forward via discussions, through engagement, policies, practices, and yes, speaking and speaking loud as a united people in the streets and wherever, that enough is enough. And we can and must do this.
Great. Thank you, Lloyd, for that. Pam?
Yeah, I feel very much like Lloyd, right? That how unfortunate does it take an 8-minute, 46-second video watching a man be suffocated to death to have us move. But I suspect our communities of color have been telling us this a long time, right? This isn't new for most of us. This is based in long-standing history of systemic and structural racism that has reared its head in a variety of formats, whether it was 1619, the introduction of slavery in the Americas, whether it was during Jim Crow, as Michelle Alexander calls it, the new Jim Crow period of mass incarceration and police brutality, or things like healthcare disparities and inequities. These issues have been pervasive and persistent, and it's going to take the same pervasiveness and persistence of each of us to tackle these historic legacies of racism. You know, my background is in public health. We've been saying for years, for decades in public health, that race is such a large indicator of poor health outcomes. And even in the enormous body of literature, when you read the confounding variables, whether we talk about income, insurance access, whether we talk about gender, where we live, income, whatever the confounding variable, race gaps still persist in health outcomes, which means racism has to be addressed in order for us to reach health equity in the United States.
Yes.
And what makes this particularly challenging is that all of those variables are interconnected, right? So if you have low income, you're less likely to have high education or suitable housing. you're more likely to live in a food desert environment. And conversely, if you have low education, you're likely to have low income. And so these things are so terribly interconnected, we get distracted by addressing one element, but never fully addressing the other element, which I would contend is race. And so as Lloyd says, until we come together and acknowledge in truth and candor and transparency, quite frankly, and empathy and compassion, we are not going to get much further, my personal opinion. I am trying to remain hopeful, but I'm tired, and I know many of my colleagues are tired because often we're at the forefront of leading those conversations.
Absolutely. Absolutely. Thank you, Pam, for that. Micheline?
Yes. I want to almost say yes and amen to everything said so far by Pam and Lloyd. I will tell you that as we find ourselves at this incredibly interesting juncture in time, you know, people have said, why is now different? And as I look back upon the civil rights movement and certainly other struggles, right, there have been other marches before, but I don't think that we've ever seen the incredible diversity that we are seeing right now, that we've ever seen marches like this and attention that has been really provided across the globe in Barcelona and Berlin. There's a reason for that. Who would have thought on January 1st of 2020 that we would have been at this stage, both dealing with a global pandemic and an international revolution, right? So as we look at where we are right now, it is high time for this much-needed discussion. It is really that which in healthcare, oftentimes we do in fact say, well, race is an indicator, and sometimes I stop us and say, actually, it is racism, right? But that, the weathering of the experience of being blessed with this melanin, but and being in this country and others under systems and structures that are not designed for our well-being, that actually weathers us, right? So there's been a lot of focus in our industry around the social determinants of health. But that conversation, that focus, has only been part of the discussion. If, in fact, we do not talk about the structural discrimination that is a product of a wide range of laws, policies, and social norms, many of which are deeply rooted in historical practices and processes and systems, even within healthcare today, we will still only attempted to effectuate a cure for half of even a symptom rather than the entire disease.
Absolutely. Thank you, Micheline, for that. And Jean?
Yeah, picking up on the idea Micheline just said about a disease. I mean, you know, we talk about the contagion that is COVID-19. We need to be talking about the contagion that is racism, right? And that infiltrates all of our institutions and have for decades and decades and decades. And I think what you're seeing throughout the country is that this tension has existed just below the surface in just about every community. When I think about Minneapolis, you know, I think of it as a fairly progressive city, home of one of my favorite artists, Prince, right? And I think about it from that perspective. When you think of Atlanta, you think about it progressive. But if it can happen in those communities, it can happen really anywhere in the country. And I think you got to go back to some root causes. The Washington Post did a wonderful article, if you haven't seen it, a couple of days ago, that basically said that there's been, and let me say this very clearly, there's been no progress in income and wealth inequalities between now, 1968, or going before that, right? So no progress through my lifetime, no progress. If you look at, if you combine, you have to combine 11.5 African-American households to equal the net worth of one white U.S. household, okay? 11.5 to 1. And then even if you have a typical African a household that's African American headed by somebody with an advanced degree, right? Somebody with advanced, they have less wealth than a white household that only has a high school diploma. So think about that. So there hasn't been any change. And that's really, we know the healthcare statistic. This crowd knows the healthcare statistics. I mean, African-American infant mortality rate is twice as much as the rate for the majority population. African-Americans experience hunger at twice the rate of white Americans. Blacks are incarcerated 5 times as much. So I think what the time that we're in right now is that this American dream continues to be far, far out of reach for the majority of African Americans on the whole. The promise of the civil rights era that I grew up with and my father would, tell me about and we talked about as kids is not really being realized right now for the majority of African Americans. And I think that George Floyd's public death and murder was a tipping point, has been a tipping point. I don't think we can go back. It's laid everything raw and bare, and it's a multifactorial: healthcare, education, mental status, everything that my colleagues have highlighted. But I do think we are at a fundamental crossroad in our country. It feels that serious, and it's a go left, go right moment. We can either live the better angels of our nature, as Lincoln said, or we're divided, we will fall. And I do think we're at that moment because you take the pandemic, the social unrest, and the economic distress all combined. We have to figure out how to work our way out of this as a country. And I think there was mention of the protests that are happening internationally in Barcelona, in Spain, because they're looking to us as models of how to do this right. And I don't want to fail them. I don't want to fail us. I don't want to fail the world.
Thank you, Gene. Scott?
Yes. Gene, Micheline, Pam, and Lloyd, thank you very much. Gene, let me start with you. We start with a massive problem in our country in terms of how African Americans are treated in all different ethnic groups in our country, all different races, face some level of racism, but nowhere near the amount that African Americans have felt or endured in our nation. Gene, I'll start with you. How do you start to improve this or bridge the gap? When I have conversations with some of my African American colleagues, I talk to them about something like you just said, about how they talk with their parents, and their parents who saw so much progress in a very difficult America are now seeing so much of that progress sort of fall back and have not seen a lot of progress in the last 30 to 40 years after such progress a long time ago. And you look at the stats, and they're very damning. They're very challenging. Gene, how do you look at this to someone who would be a parent of yours who's distressed about, oh, my God, how have we not done better in our country? And think about how do you start to bridge this gap going forward? How does this get better? How do you bridge this gap?
Yeah, I mean, I think there's a couple things that come to mind. One is that I think we've been reticent sometimes in this country to have the conversation about race. It's uncomfortable. Some folks don't want to talk about it because they might say the wrong things, they think. And I do think it starts with that courageous conversation. If you're in the field, if you're in any organization, if you're a leader, throw the scripts away. Listen to your teammates and your colleagues of color. Ask them how they're doing, what barriers they're seeing, how they're feeling about the state of things. That's what I invited all my 70,000 teammates to do. Is I invited them to have that conversation. And quite frankly, I was speaking with Patrice Harris, who was a former chair of the AMA, and I loved what she said. Is also we have to, the people that you're seeing have to not self-edit as much as well. So I'm finding myself having more of a courageous conversation. Last Friday, I spoke to 50 Black men that are on the organization because they're really hurting and they needed an outlet. And I started telling about my own experience. I haven't shared that before internally. The time where I was pulled over and when I was in my 20s and searched with dogs, the time where I was denied my first CEO job, is clear that I was denied because of how I look. And so I think it does start with having the conversation. Too many of us have been polite around it or scared to have it. I think that's one. The other thing I would share with my colleagues is that most of us and certainly on this panel, but all my colleagues are sitting on other boards. And I think that the idea is don't just use those positions of influence within our own organizations. I think we have an opportunity to use that and leverage that more broadly and have the right conversations. I sit on the board of Best Buy. We had a board meeting last week. We're talking about teen tech centers and minority communities, and what are we going to do about that? I sit on incoming chair of the Richmond Fed Reserve. We're talking about structural inequities. So I think it starts with having the conversation. Now, as Lloyd said, you have to have the conversation, but then the conversation has to lead to something, has to lead to real action. I think we're at that moment where we have to really be very specific about what those actions need to be in all of our institutions and what are we going to hold ourselves accountable for as Americans.
Micheline, similar question. You spend all of your time literally focusing on these issues of health equity and diversity and how do we improve things. What can be done to help bridge the gap?
So much actually can be done. And the reason why I say it in that manner, Scott, is because oftentimes individuals take a look at this and say, well, what in the world can you do about racism? It's like, what in the world can you do about poverty? Well, there's actually a great deal that can be done. And I think that my colleague Dean just walked us through, right, what that looks like. But it will not happen if, in fact, we do not decide to take it on, right? And so it's going to require courageous conversations. You are correct. I am in a lot of settings where that is exactly what I do, whether it's policy and governmental affairs hat, since that's my background, or whether or not it's in a discussion on the Federal Reserve Bank of New York or anywhere else. We are still having discussions about equity, but now we've got to be able to mature the discussion around actually racism, right? And what it looks like when you have an organizational culture that permits racism to exist, how it shows up within those organizations, and how it manifests, right? So one of the things that I like to make certain that I refer to individuals is that they take a look at the fact that there are actually guidelines on what white supremacist organizational culture is, how it shows up there, and then, quite frankly, utilizing a racial equity assessment tool in order to evaluate every single administrative, operational, and clinical decision you make, right? So that sounds like a lot. Yes, in fact, it is. But it is required in order to literally go about the business of trying to create an environment of anti-racism, right? It has been here for a long time. It has been here for so long that, quite frankly, as individuals are now protesting against it, people think that they're protesting against America because it's literally an aspect of the very fabric of the foundation. So we need to make certain that folks understand that it is okay not to know quite what to do, but to say nothing and to do nothing, that is unacceptable. So we really have to begin reevaluating our policies, our practices, our decision-making process. Who has power in the organization, right? Whether or not, as we render policies, are we doing it all through a lens of privilege, right? Or are we actually encouraging others who have had a lived experience that is different from everyone else who tends to traditionally have positions and suites like ours? Are we, in fact, inviting them to be a part of that? And then, quite frankly, how are we driving this conversation down and throughout these organizations? statements. I think Jane just referenced, and I know that my other colleagues have also done a great deal. Everyone, right, they've issued statements, but this is not a one-statement issue, right? So are we, in fact, creating opportunities for safe space discussions, courageous discussions across our virtual platforms, and so many actually are? Are we, in fact, equipping our organizational leaders with the talking points that they need in order to make certain that you can say, listen, I am uncertain, I have not walked in your shoes, but I want you to know that you are valued and worthy, and I see you, and I want to learn how to do better? Have we made certain that there are actually teeth in any of our discussions and decisions around what will and will not be acceptable in an organization? Have we literally ensured that individuals understand that that is unacceptable here? And so we're going to make certain that we do not permit the water cooler talk, or, quite frankly, the institutional, systemic, and structural that has always been to remain, because of the fact that we're going to be committed to an anti-racist agenda. So there's a lot.
Thank you. No, thank you very much. And it is a systematic issue that goes back really forever in our nation. There's no way around that discussion and things that have been mentioned. I can't talk to an African-American executive or professional who's not had the experience that Gene has had, where he's been pulled over and treated far differently than a Caucasian American would be treated by the police, and the same thing in boardrooms and other places. So I appreciate the sharing so candidly. Pam, let me ask you this question. In addition to sort of bridging the gap, Gene, Micheline, you, Lloyd, have talked about systematic differences in economics. Gene made the point it's about 11 African-American families to equal the net worth on average of one Caucasian family. How do you start to deal with bridging these gaps and addressing systematic problems that are so significant? How do you start to bridge those gaps?
Yeah, I think it can quickly get overwhelming, right? We start getting distressed about how deep the challenges are. But I think Michelina mentioned a lot of them. And as we think about economic parity, part of the reason COVID was such a problem in communities of color was because we were in the essential worker positions, right? Where we had to be present. But are we evaluating the pay scales of our essential workers? Or are others getting extraordinarily wealthy off the backs of those individuals who are now deemed essential? And are we providing a living wage that allows them to afford housing and healthcare and other necessities? I think we have to reckon these really tough questions for ourselves in the American society. And it's a difficult one, right? Because we're rooted in meritocracy. We believe in kind of pick yourself up by the bootstraps, where everybody's not necessarily giving equal opportunity for education. I think we have to start thinking through the lens of equity beyond just words, but really think about equity instead of equality. And what does that mean? How do we put people on a more level playing field very early in life? I love the focus on children, and there's quite a bit of literature now that says we really need to think about childhood trauma. What are all the children who have experienced the visualization of George Floyd's death experiencing in terms of trauma? And what do we now do with that to provoke change and to promote education in a different way so that children are having courageous conversations? I'm an affirmative action baby, right? I was given opportunities. My test scores probably didn't match my peers, but I was chosen for admission into some very important, prestigious schools. I would have never have attended those schools. I didn't even know they existed when I was in high school. And we have to be comfortable with creating environments of equity that give opportunity to people who have historically not had opportunities. There's been so much backlash against that. And I think we're going to have to reposition those conversations. We have created a national government that has pitted people against one another intentionally. And those issues come to pass when we intentionally bifurcate people and promote discrimination among different groups for whatever reason. We then aren't compassionate and don't act out of empathy to position people for promotion and development over time. And that requires resources. It requires redistribution of resources. I think we hear a lot about defunding the police. I don't know exactly what my position is on that, but what I do know is we have to find funds to support programs and structures that, the pool is not unlimited. And we've got to figure out how to reallocate resources to support those things that are going to be long-term improvements to the economic well-being.
Pam, let me ask you two follow-up questions. And I love your thoughts on, do we much more fully need to embrace rather than fight affirmative action as a pathway for equity? That would be one question. The second question I have for you is one around nationalized health care. Do we at some point need a nationalized healthcare system just to level set, at least so everybody has some minimum level of health benefits? And again, just your quick thoughts on those two issues.
Yeah. And I think those two issues go hand in hand, actually, education and healthcare in some realms as public services. I personally, again, this is Pam Sutton-Wallace's opinion. It's not an institutional position. I do believe there needs to be some form of universal health coverage provided to all, or some level of mandated benefit coverage by employers. Now, I understand the complexities of how do you pay for that. Those are the kind of redistribution, reallocation conversations of our different pools of resources. I also believe those resources should be used to support the providers of care. Those resources shouldn't be used for those who are not delivering care. Again, tough conversations. What does that look like? I believe, reinstating some of the elements of the ACA. The ACA was working until we eliminated some key portions of it, and then in essence created financial disincentive to participate in those programs. In terms of education, and whether you call it affirmative action or not, I do think, and we're starting to see many schools have eliminated, for example, the SAT, ACT, because they, in fact, don't prove to be highly correlated with academic achievement and success. They're highly correlated with a student's background. And so I think we need to be more mindful of what is needed to predict success, and then what do we do to support that, and how do we offer that through the course of one's educational pathway to ensure that students, whether they're secondary or college, to support their growth and development, to afford opportunities for professional advancement in the future. And let me say, I think that extends beyond just formal education. It plays itself out in professional development within our institutions. And so if we think about pipeline programs, yes, they take a long time, but the investments up front have proven successful, that when you invest in junior, early careers, mid-careers, they develop into successful executives. Same is true with physicians. When you invest in people of color, Black students, invest in their secondary college education, they are well prepared for medical school, for residency, on through fellowship, and becoming attending level physicians and providers.
Lloyd, I'm going to ask you a similar question. Pam, thank you very much. Just very helpful and thoughtful. Thank you. Lloyd, you famously talk about growing up where healthcare in the family was, if you had a bad tooth, it was your father pulling the tooth out. It was really what Pam talks about, this building it up by the bootstraps American experience of really coming from nothing into great success. You've been on the McDonald's board. You run a $30 billion plus system. You're really the example of the American dream. How do we bridge this gap so everybody has that chance at the American dream, and it doesn't require such Herculean efforts to get through the systematic racism? How do we bridge this gap further?
Thank you again, Scott. First of all, I would say that a question that I think is on everybody's mind, and the questions that friends or foes or those who have experienced racism and those who deliver racism. Right now, everybody's asking, what is it that we should do, and how did we get here? First of all, you have to reflect on history. Anytime a group of people are brought to a nation chained and bound in slavery, by that act alone, you have set forth a certain kinds of behaviors, and you have put people as a race in a position. So one of the things that frustrates me is that when we talk about this issue, is that we talk about segments of it. We talk about police brutality. We talk about discrimination in the boardrooms. We talk about, and I could go on and on and on. And I think one of the reasons that this nation has not been able to impactfully address racism is because we accept incremental gains or episodic related solutions. Okay, we're gonna invest in education, and that should satisfy this. So I think we have to understand that racism manifests itself through many different lenses. And if we do that, we will understand that, yes, we absolutely have to address the criminal nature of any kind of brutality, in any kind of discrimination. But what we can't do is come up with this single solution. Housing, economic disparities, health disparities, education, access, equal access in this nation are all a part of this pie that we talk about when we talk about racism. But we as African Americans, but most importantly, we as people in this country and around the world, we get so tired, we get so frustrated that we psychologically begin to accept incremental gains as opposed to macro solutions to issues. So I think first we have to accept that racism presents itself in many, many forms. I've sat in meetings where colleagues and people I'll say that I consider dear friends will say, I don't know why I'm here. I'm not racist. But it's the same individuals that I will hear that will say, I don't know what's the issue. We have 3 African Americans and 2 Latinos out of 200. What more do you want me to do? Mm-hmm. That in and of itself, in terms of accepting in an incremental number, is part of the problem. So I think that, when I think about my journey, and I've been on this earth a long time, probably longer than most people on this call, I go back to where I started. My great-grandfather was a slave. And I was born in Montgomery, Alabama. So I know discrimination, but that was one kind of discrimination, but it began to manifest itself in the kind of jobs that my grandfather and that my father could get. It manifested itself in what kind of schools that myself and some of my brothers could go to. And that brings us fast forward to where we are in healthcare in this, and where we are relative to this subject matter in the country. And I think one of the things that we have to do And one of the things that we cannot accept as a nation, as caring people in this country, is Band-Aids being, as Jean said, being put on cancers. We have to figure out how and what are the treatments and how are we going to address this in a systemic way. And again, I sit in meetings where people say, well, this is just not going to happen overnight. Well, I said, what about 400 years and a night? Is that enough? Is that enough? So I think the point is clear. So I think that from a policy standpoint, from an economic, from an education, from a housing standpoint, from I could go on and on. We have got to have a multifaceted set of solutions for a multifaceted issue. But we will never, we'll be, I'll be dead and gone, and there'll be another group sitting here talking about this based on some other kind of incident. Decades from now, if we don't accept and we don't seize this moment to say, we are going to come at this issue holistically. I don't spend much of my time on the blame game because we know the who's and we know the how's and we know the why. There are people that get pleasure out of keeping other people down. But until we can articulate and identify what we will tolerate and what we won't as a nation and as a people, we will continue to just take little bites at this apple. And I think those of us in healthcare see all forms of racism played out in our EDs, in our ERs, and in many aspects of what we can do. So to me, it's not about the what, it's about the will. We know enough. We know the segments of racism and where they exist. But the question is, do we have the will and do we have the full engagement and the consciousness of those who are oppressing to be able to move forward with solutions? My story is a story that is being played out in this nation as we sit here today. But it manifests itself in different ways and in different masks, Scott. So that would be what I would add to your question.
And Lloyd, I'm going to turn it back to Tony in 1 second, but as I hear you and try and summarize what you're saying is, it's less this program or that program, and it's more a holistic view of how do we bring up our fellow citizens, how do we make it an all-inclusive way versus fixing this or fixing that. Fixing this and fixing that are part of the issue, but it's really a holistic attitudinal change of how do we view everybody as community, as part of our own community, as our whole community, and how do we help the entire American community.
And what I'm saying, Scott,
is
let's first accept that we have racism in this country. Let's not, let's just accept that is. Okay, now, what do we do about it? I think there is a consciousness, and certainly a growing one, that people want to help solve it. So let's get real about the solutions, but let's not keep denying and tinkering around with, it's a little bit of racism, and let's just accept where we're starting from, and let's come together and let's acknowledge the problem and let's move forward with solutions.
Yeah. Thank you,
Lloyd. Tony, let me turn it back to you.
Thank you. Thank you so much, Scott. I mean, so much has been said, and I'm so anxious to talk. And we don't have a lot more time. And as you said before, this is going to take several conversations for us to get to a solution. But what concerns me, really concerns me the most, and Micheline, you began to talk about this a little bit as you talked about, is this time different? We've gone through the civil rights movement. We've gone through the civil rights riots. We've gone through the riots of Dr. King. We've gone through the riots of Rodney King and so on and so forth. And each time after that, you give us a year, give us 6 months, give us 2 years, and we're right back where we started from again. You know, the one wonderful thing about a crisis is a crisis will make you stand up and pay attention. But a year later, a year and a half later, people are done with that and we're on to the next thing. That's my biggest concern. So I would agree that this time is different in that we have an international movement. We have people of all colors, all races, cultures involved in this message. But the concern becomes a year from now or 2 years from now, as Lloyd said, will we be still having this conversation? And I think the onus really and the responsibility is in this virtual room today as Black healthcare leaders, a responsibility to ensure that we're not still having this conversation a year from now, 2 years from now. And I say that, and I ask you, and Jean, I want to start with you because, you know, people look at each of you in this virtual room today and say, oh, they're different. You know, you're executives, you run things, you're very different. So I'm not talking about you. But at the end of the day, when you leave out of that hospital and you get in your car and you head home, you just like everybody else for the most part. So there is a sense of responsibility, I believe, but I want to hear from you. What sense of responsibility do you believe you have, not just as an executive in healthcare, but as a Black executive? And with that responsibility, what kind of accountability do you believe comes with that, Jean? Yeah,
well, to your last comment, there's a physician that we have in our Georgia hospital that said exactly that when he feels safest when he's in the hospital, and then when he leaves the hospital, he keeps his white coat on the front seat of his car because he wants people to know that he's a physician. So I think that's still our lived experience. I think people need to understand that. As to the question, you know, let me just step back. I'm actually, and you may revisit 6 months, a year, and 5 years from now and say you were too optimistic. I think to what you said, I do think this is a moment we can do something. The multicultural nature, the multi-generational nature of the protest. But here's what I would say to your question, though, because I think we're all in terms of change and social determinants. We have decades of a career to show that. You know, I think there's a realization that African Americans can't change this by themselves. We need the support of the white establishment, and I'm hearing that much, much more. I was speaking to a police officer that says, "I can't believe you have to prepare your kids for when a police officer pulls them over and you go through this whole thing. Why do you have to rehearse for that?" So, and he said, "Well, it's my responsibility to stand up." So I do think where I'm more optimistic is that I see more folks in the white establishment that are realizing silence is not an option. Silence is being complicitous. This is not a political statement, but you had Mitt Romney say Black Lives Matter. The top military officer, U.S. Joint Chiefs of Staff, say what we are seeing is the long shadow of our original sin in Jamestown 401 years ago. So right. I think that if we take this moment to really, one of my teammates said, there's more of us than there are of them. And what he meant is that us who right. are publicly saying this and those who are silent, right. if we start talking, there's many more of us than there are them. And I think this is the moment to convert that into action. If I would just say three quick things to tie the former conversation. Frederick Douglass said that it's easier to build strong children than to repair broken men, and I would add women. So this conversation, this is the moment right now of education. If you look at high school graduations, African Americans graduate 69% versus 86% for whites. So I think this is a moment to convert that into structural reform. We talked a lot about police reform and where are we going to get the money to have deep structural reform. Well, you know, in New York City, just a few years ago, $300 million was spent on settling lawsuits and police brutality issues. Take that $300 million that paid for going wrong and then invest it in community policing. I think
Absolutely.
the money, what Lloyd said, if we have the will, we can do things like that. And then the third thing, we can't not have a conversation about Medicaid expansion. If you look at in terms of we have to take this moment to do that. If you look at the states that haven't expanded Medicaid, they're in the South, Southeast, right? That's where 60% of African Americans live. And then you got Texas, Florida, and Georgia that has the highest number of uninsured. This is a moment now to realize that the health and the COVID disproportionately impact on people of color is inextricably tied to how we fund healthcare. And so I think these are moments, if I'm optimistic because I'm hearing other folks talk, but we have about a year to really begin to put these structural solutions into place. Otherwise, we will be in the same place 2 years, 3 years, 5 years next month.
Exactly. Ms. Shalene, can you, we're ending the conversation in a few moments, but I would love to hear you sort of sum this up and share with us what your message to your white colleagues might be in a message on how do we begin to write. And I know we've talked about all kinds of ways that we can begin action. But in those first initial steps, getting beyond just conversation, how would you, again, give a message to your white colleagues about how do we begin to right the wrongs of the health disparities and inequities we've been experiencing for decades in our organizations?
Thank you so much. It's so interesting. I actually just penned an article that hasn't even been published yet on that very topic. I think that what I would say to them is that we need them. And the reason why I would say that is not because it is the issue that we do not want to take on the issue ourselves, but quite frankly, the issue at hand is the fact that this is where allyship really needs to show up, right? So I need to make certain that our white colleagues, right, and other persons of color who are not African American, that they have a full understanding of two things in particular. One, that your black colleagues right now are not okay. Your black team members right now are not okay. That right now this is a really significantly emotionally impactful episode for us. But also, it is more than just one episode. That it is for them to utilize the position of privilege that they have from whatever seat they sit in the organization, whether or not it is the CEO or the COO or most importantly the CFO, but even if they are mid-level managers, that they have got to speak up, that their silence is being watched and remembered, especially right now. I want them to know that the beauty of anti-racism is that you don't have to pretend to be free of racism to be an anti-racist. That anti-racism is the commitment to fight racism wherever you find it, including in yourself, and that is the only way forward, right? I want them to fully understand that what allyship looks like is not for you to come to me after the meeting and say, well, I can't believe they said it to you, but quite frankly, for them to sit in the meeting in and of itself and to pause, to cause it to stop, to be disruptive in order to ensure that equity, not equality, is the actual outcome and goal. I think when you say, to summarize it, what have we heard? We have heard the giants in the industry enunciate that it does not matter what seat we sit in once we walk into the building. Because when we walk out, we are just as much in jeopardy as anyone else from our community. And that each and every time we have witnessed such a public lynching, that we have felt it in a significant and deep place. And that we are looking at you every day when you come into the office and begin a dialogue where you do not stop and say, how are you? Are you okay? And what can I do? That we have felt failed by you in those circumstances, and that now is your chance to try to make it right. That most importantly, do not talk to us about what you understand is wrong. Go and talk to every single person who looks like you, especially those who sit in seats of power. That's what I would tell them.
Great. That's fantastic, Micheline, and I really appreciate that. And it really, at the end of the day, is really about allyship. And we have to continue to advocate for that and to have that conversation. And just as Jean said, it's probably not a day conversation, a week conversation, or even a year conversation, but a conversation that has to continue. And it has to be courageous, and we have to be bold and insist that this time will change for the good of all those that this has impacted. So Scott, thank you for allowing us to have this platform. I want to first and foremost, before I hand it to you, Scott, to say thank you to my colleagues who've joined us in this conversation today. Thank you for being so transparent and so authentic with the conversation. I really, really appreciate that. And we've only sort of tipped the tip of the iceberg in the conversation. I mean, this can go on. And so, Scott, I'm going to hold you to continuing the conversation in the very near future.
Thank you, Tony. I want to wrap up with a couple thank yous to Asia Tanner, Emma Goodman, Jessica Cole for organizing this today with us. I want to thank some of you I consider long-term friends. Lloyd, I've known you for years. Tony, for years. Jean, more the last few years. PM, I've had a chance to visit with you before. Micheline, several times the last couple of years. It is a privilege for us, for me, for Becker's Healthcare, to have a chance to be part of this dialogue with you. And we hope to continue it. We hope to see change. We're touched by your efforts and what you do. And it's a crazily fascinating educational experience for those that are Caucasian, white, whatever you want to call us. It is a fascinating learning experience. It shouldn't be, but it really is. And I appreciate so deeply your sharing your thoughts with us today and always, quite frankly, just magnificent. A couple of you served on our advisory board in Hampton for the last few years, and I can't tell you how much we appreciate your inclusion of myself in your efforts. So a true privilege. I thank you, Jean, Pam, Lloyd, Micheline, Tony, always. Thank you, folks, very much for joining us today, and thank you to our audience for being with us today. Thank you very much.
Thank you.
Thank you. Good night to all.
Thank you.
Good night.